All right, so chapter 4 is on the development of the face and palate. So we're going to look at how the face develops in more detail. We're also going to look at how the palate develops. Palate is like the roof of your mouth. So if you stick your tongue up inside your mouth, you're going to be touching the roof of the mouth, which is known as your palate. Sometimes during development, the palate doesn't close, and then we're left with a cleft palate. Sometimes the lip doesn't close, and that's known as a cleft lip. It can be unilateral, which means just on one side, or it can be bilateral, which means it on both sides. So let's look at it in more detail. So when we're looking at an embryo, let's review what we see. So here's an embryo. We can see the oral pit, right? This is where the mouth and the stomach and everything will get deep. It's like the opening of the mouth and the stomach. Remember, it's called the stomodymium, which is another word for oral pit. On top of the oral pit, we see the frontal process, the frontal for the forehead. So this is where the forehead will develop. This over here in yellow is the maxillary process. So maxillary is the upper jaw. So there's one on each side. And then we have the mandibular arch, which is the lower jaw. So all this comes from the first arch. So remember we were looking at pharyngeal arches last time. So this is from the first arch, the mandibular arch. And this is from the second, or the hyoid arch. So what happens in the fourth week? Well, let's see. In the fourth week, if you were to measure this, the face is only a few millimeters in height. So it's really small. It's just a few millimeters in height. And the width is like as thin or as thick as a sheet of paper. So it's really, really tiny. So again, we have the mandibular arch, which is the first arch. And then we have the hyoid arch, which is the second arch. Interestingly enough, the ears actually get formed later on, as we'll see, and it comes from the second, or the hyoid arch. So again, the fourth week, this is where the face is starting to get developed. We have the oral pit, also known as the primitive mouth, at the beginning of the mouth. The frontal process, which is where the forehead is. We have two maxillary process, and that becomes the cheek. And then we have the mandibular arch, which is starting to develop in the fourth week. So between the 4th to 7th or 4th to 8th week, that's when all the face gets and the palate starts to get developed. So what happens in the 5th week? Well, in the 5th week, we start to get nasal plaques. And these are these two lumps kind of over here. Okay, so these are the nasal plaques. Right above this frontal area, we used to call it, what did I used to call it? I used to call it the frontal process. Now we call it the frontal nasal process because it's close to the nose. So the nose for nasal, front over the front. And then the eyes start to develop. So we didn't really see the eyes that well in the 4th week, but in the 5th week, we do see the eyes starting to develop on the side of the head. Let's see what happens in the 6th week. So in the 6th week, the face is expanding laterally, which means the face is growing laterally on the side. We can see the eyes and the maxillary process are coming closer to the front. We can also see, again, the maxillary process is getting wide, and the mandibular and maxillary are kind of merging as well. And here, this will be developed later on too. This is actually the formation of the ears. The auricular hillocks and there's a slide on this. This is where the ears are going to come from the hyoid, the second arch, and then it's going to come up soon. Let's look at the nose. So again, in the 6th week, what happens is when we're looking at the nose, when we're looking at the upper lip, so this is the lip, this is your nostril. The upper lip is right here. We also have something, so in the nose, we have something called the medial nasal process. So medial for like the midline, M for midline, it's in the middle, towards the midline. And then we have the lateral means side, so it's towards the edge, the side of the face. And so what's happening is the medial nasal process will eventually fuse together and they'll make a philtrum. That's that indent that we see between the nose and the lip. That indent that we all have, that's the philtrum. So the medial nasal process Another word for that is the philtrum. And the lateral nasal process, which is on the side, actually becomes the ala, A-L-A, ala of the nose, which is like the outer skin of your nose. There's something called the nasal fin, which is right here. This is basically where the fusion happens. So when the medial nasal process and the maxillary, which is the top upper jaw, when these two fuse, it's known as a nasal fin. Okay, so it's the joining of the fusion of the maxillary process and the medial nasal process. When they join, it's known as a nasal fin. What else happens in the 6th week? The ear starts to develop. Okay, so here's your ear. It starts to develop in the 6th week. We can start to see it. And these like hill shapes or these bubbles are known as hillocks. Auricular means ear, because when you think of auricular, think of ear. And there's 6 of them. There's 3 on one side, 3 on the other side. This 3 comes from the mandibular arc, where the first arc. Remember the embryo? We have the first arc. The first 3 comes from the mandibular, or the first arc, and the second 3 comes from the second, or the hyoid arc. So really, the first and second are responsible for making the ear. And eventually it fuses nicely and becomes the ear. 7th week. So when we're looking at the 7th week, which usually is the final week for the face to have most of the features, here the embryo started to take more of a human appearance. It started to look like a face more. And so if we look here, the eyes and the nose are actually on the same plane, like I was on the same line. We can see the philtrum starting to happen. We can see the ears trying to come up, and this is the eye, and soon we're going to get eyelids on the eye. So all this is happening in the 7th week, where it starts to kind of look like, now you can see the facial features developing. All right, let's look at the palate now. So the palate is the roof of your mouth. So your teeth would be here. When you get older, your teeth will be here. This is your palate, the hard palate, because that's where the bone is. The soft palate, that's a lot softer. It's just where muscles are. So we want it to fuse. We want it to close together, because if it doesn't, we'll get a cleft, which is the gap. So how does it fuse? Well, there's two portions of the palate. There's the medial. Medial means midline, in the middle. Medial palatine for palate. There's the medial palatine process. And then there's a lateral. So lateral for side, there's 2 sides, process, so lateral palatine process. So what happens is, actually before that, let's look at the medial one. The medial palate is also known as your primary palate, because it's the first one to develop. And then the lateral is called your secondary palate, because it comes later on. So medial is your primary, lateral is your secondary. And the way it works is they kind of fuse, they close together. And when they close together, it says they grow medially, which means they come in, like into the midline. So they fuse. I have a picture. They kind of fuse like this, okay? They come into the middle. So let's see where we were. When they're fusing, so when they're coming into the middle, the tongue is in the way. So what happens is they'll contact the tongue and the tongue gets pushed down. Okay, so here you can see the tongue is in the way, and then as it's fusing together, as the lateral palatine processes are fusing together, the tongue gets pushed down, as we see here. So the tongue is pushed down. Okay, so again, this happens during the 8th prenatal week. Okay, so during the 8th prenatal week, the back of the palatine process, the posterior shelf, we call it sometimes the shelf, it gets closed together, and then it pushes the tongue down. This happens during the 8th week. And where does it meet? So if you look at where it meets, it touches first right behind the medial palatine process. So right behind the medial palatine process, it just touches, and then it fuses in the front and the back. It fuses anteriorly and posteriorly. So where does it touch first? It touches, or where does it get into contact first? It first gets into the contact right here, which is right behind the medial palatine process, and then it fuses in the front and the back. It fuses anteriorly and posteriorly. Now, when we're looking at the tongue and when we're looking at the head, okay, so the muscles from the tongue and the head, they actually come from, this is the spinal cord, and they actually come from these myotomes, which are like portions of the spinal cord. And this is known as the occipital myotomes. And it kind of goes into the first and even the second pharyngeal arch, and it kind of develops all the muscles for the head and tongue. So, and when we're looking at tongue in particular, remember how we were looking at the cranial nerves? And again, there's going to be a whole section, a whole chapter on cranial nerves that you'll learn in orofacial, because there's 12 of them. This is the brain. If you flip the brain and you look at it from the inferior or from the base of the brain, at the bottom of the brain, you'll see all these cranial nerves. These are all nerves that go to that send signals to various parts of your body. And so what we're looking at here is the tongue is innervated. So the tongue gets the nerves, the feeling of the tongue happens through these cranial nerves. And there are 1, 2, 3, 4, 5 nerves that supply the tongue, that go to the tongue, and that helps us, have taste and helps us feel the tongue and helps us move our tongue. So let's look at that. This is the trigeminal 5, okay, trigeminal nerve, which is the 5th nerve, and that one goes to the front of the tongue, okay, so it allows us to feel the feeling of our tongue is there because a nerve gets, sent there, and that nerve is the trigeminal, the 5th nerve. We also have the 7th nerve, which is the facial nerve, and the facial nerve gives us taste also in the anterior. So the anterior part of the tongue is supplied by, the reason why we can have feeling and taste is because of 2 cranial nerves, which is the 5th trigeminal nerve, 7th facial nerve. Then when we're looking at the posterior, the back of the tongue, we have the 9th nerve, and the 9th nerve is the glossopharyngeal. And when you see glossal actually means tongue. So if you know that, if you can remember glossal means tongue, then you can know that this is to do with the tongue. So glossopharyngeal nerve helps the back, the posterior of the tongue, and so does the hypoglossal. Remember glossal? So glossal means tongue. So the hypoglossal also helps innervate the tongue. And same thing with the vagus nerve. So we have another nerve, which is the 10th one, which is the vagus, which also helps. So 1, 2, 3, 4, 5. This is the embryo, and these are the pharyngeal arches that we looked at before. Just so we know, the first arch makes the front of the tongue, the anterior of the tongue, and the second and third makes the back, the posterior part of the tongue. Okay, so first arc is the front, the anterior, more movable is the tongue we can move, the part that we can move, and the second and third make the back of your tongue, the posterior, which is less movable. Again, when we're looking at the tongue, there are some tissues that, make the tongue. So we have the tuberculum impar. Tuberculum is like a projection, a protrusion, like a bump. Okay, that's like a bump. And then impar kind of means it's like there's only one. It's not bilateral. There's no 2. Impar means there's only one of that bump. And then we have the lateral lingual. So lateral means side. Lingual is another word for tongue. Lateral lingual swelling. So there's another thing, another tissue, and they all help form the tongue. And you can see there's a U shape kind of sulcus that kind of gets developed in the front of the tongue, and it's helping with the making of the tongue. So when we look really closely at the tongue, this is the body of the tongue, and this is the base, the back of the tongue. And then it's separated by a V shape. So here's the V, a V-shaped groove, and that groove is called the terminal sulcus. So right here, terminal sulcus. And when the whole mouth is developed, you can actually trace a ring right here. And this ring is called the Waldeyer's ring. And the Waldeyer's ring is where all your tonsils lay. And you'll learn about tonsils in another section. But we have so many different tonsils. You're familiar with the palatine tonsils, but we also have lingual tonsils, like tonsils on our tongue. We also have tonsils on our pharynx, the pharyngeal tonsils. So this ring, if you draw a ring around it, all the tonsils are within that ring. That's known as the Waldeyer's ring. All right, thyroid gland. So we talked about thyroid gland before, and we said that thyroid gland is, located like right over here underneath the neck, and it's responsible for metabolism, for us to grow, for us to develop. So it's a really important gland, and it starts from the foramen system. So if I show you this right here, here's the tongue, and then there's a foramen. A foramen means an opening. There's like an opening here. It's known as the foramen system, and this is where the thyroid gland starts to kind of get formed. Let me show you a better picture. So here's the foramen system, and you can see the thyroid gland, which is right here, starts to go down, 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 and it goes to where it's supposed to be, into the neck. Okay, so it starts at the foramen system and then just migrates downwards until it goes to where it's supposed to be. Now, as it's migrating, there's this, imagine a line being formed. Actually, the line is like right here from the tongue to the thyroid gland, and that line is a duct. So it travels over here, and that duct is known as a thyroglossal duct. Glossal for tongue, because it's at the tongue, and thyro for thyroid. So it's a duct. That duct actually eventually disappears, but just know that there is a duct. It's called a thyroglossal duct. Sometimes what happens is it can get swollen, which is called a thyroglossal cyst. So sometimes as it's migrating down, we can get some swelling. A fistula, right, is also another thing, a swelling that can happen, and you can see it from outside. So all this can happen where as the thyroid was going down from the foramen system, from like the back over here all the way down, it can create some issues like a fistula or a cyst. All right, so cleft lip or any malformations. We're going to look at cleft lip. We're also going to look at cleft palate, and these can occur because of an environmental or genetic factor. So genetic means your parents, your grandparents, if they had cleft lip, there's a chance that you as a kid could get it when you were born. Environmental could be like your surroundings. So if you're surrounded by stress, it could be pollution, it could be smoking, it could be, anything really, but stress can cause this. So if you're pregnant and you're going through a lot of stress, it can cause cleft lips. So interestingly enough, that there are racial differences. So a white child, okay, it's more common in the white population. 1 in 700 births in the United States can get a cleft lip. Not so much in African Americans. It's 1 in 2,000 as opposed to 1 in 700. And again, in the Asian population, it's less. It's less than the white population. It's 3 in 2,000. In 2,000 births. Boys, white boys get it more than girls. And so what can happen? What are some different things that can happen if the palate or the lip doesn't form properly? Well, you could get a cleft lip only. You could get a cleft palate only. You could get a unilateral, which means on one side, unilateral complete cleft lip and palate, or you can get a bilateral complete cleft lip and palate. So the lip and palate are affected. Bilateral means on both sides. So it can be unilateral or bilateral. So unilateral means only on one side. Bilateral means you see it on both sides. It can be complete or incomplete. Incomplete means it goes all the way up to the nose. Incomplete means it doesn't go all the way up to the nose. And you can even get a hair lip, which is like a midline cleft. Really rare, but it can happen, okay? So a midline cleft is known as a hair lip. Mandibular clefts can also happen. Mandibular means the lower jaw. You can get a cleft on the lower jaw, but it's really rare. The reason why this happens is because maybe there was so much pressure from the heart, so the heart was pushing up on it, and it just created that cleft. So again, this is the palatal cleft. Now, sometimes palatal clefts can happen without the lip, but usually if you get a cleft palate, you get a cleft lip. But here we can see it's just the cleft palate. That's usually happen with both. The lip and palate you can see that cleft on both, but there are situations where it's just the palate that's involved. What are some other defects? What are some other things that can happen when the baby or the embryo is in the womb? Sometimes what can happen is, or most commonly what can happen is malocclusions of the teeth. So the teeth are crooked, they're not like, straight. That's usually what happens when things don't develop properly. Another thing that can happen is mid-facial hyperplasia. And mid-facial hyperplasia is basically when a child gets born, and you can notice that the upper jaw, the cheekbones, and the eye sockets, they haven't grown as much as the rest of the face. So there is some widening or some weird spacing, for example, that can happen mid-facial hyperplasia where it didn't form properly. And so those are other things that can happen when a mother is, or when a pregnant woman is has some genetic conditions or some environmental stress or environmental factors that is preventing the baby's face to be formed properly. All right, that's it.